I'm Dr. Stewart, a clinical psychologist and co-director at the Mood Disorders Clinic. So today's video is about how to get the most out of therapy, as well as how to get the most out of your therapist. So I sort of have 6 top tips there. First thing that is super important is actually getting the right therapist. And what I mean by that is getting someone that you know is actually going to be able to target the issues that you're coming in with. So that's about experience and expertise. Then the next thing is actually having a good fit with your therapist as well. So it's not enough that they know what they're doing and how to target your issues, but also that you really get along with them. Without that, you won't have trust, you won't feel able to be open, you might feel judged, and then you've closed off. The third thing is having clear goals. Now I know this is really difficult because sometimes you might come in actually not knowing what your goals are, and that is okay. But what's really important is that your psychologist actually works with you to identify those goals. So one of you at least has to know what the goals are. And if you aren't sure, then you've got to challenge your therapist or ask those questions and say, hey, what are we actually working on today? Or what is the treatment plan generally? Please let me know so that I know what I'm working towards. Otherwise, you won't know what the outcomes are going to be in the first place. So then we've got, all right, it's not enough to have the right therapist and the good fit and the clear goals. You actually also need to understand what to expect. So that's number 4, coming in with expectations that you're going to be, done within one or 2 or 3 sessions. That's a bit unrealistic. So actually talking to your therapist about, what is the timeline, what can I expect here? That's really important. And that also means you're still challenging your therapist to tell you what to expect and how to get the most out of therapy. Okay, so then we've got right therapist, good fit, clear goals, and you now have the realistic expectations. To add to that though, you also need to work on the tasks outside of session. The in-session process is only the 50 to 60 minutes once a week or once a fortnight. That's not enough. You've got to be working on the goals outside of therapy as well. All right, so number 6, last one. We now have the right therapist, the good fit, the clear goals, doing tasks outside of session, having realistic expectations, but then also that progress isn't necessarily going to be this consistent, perfect line of improvement. You've got to be ready for a dip here, a dip there, without feeling like, oh, it's all ruined, I've gone completely backwards, now there's no point in therapy anymore. Those are exactly the times where you need to go back in, see your therapist, work through that, and really pay attention to the progress that you're actually still making. That is key to continuing doing the good things that you've already been doing to make up for those little dips that do occur throughout therapy. So there you've got it. Those are my top 6 tips on how to get the most out of therapy and your therapist. Good luck.